Welcome back to Learn with Professor Janula. If you're a nursing student, this channel is just for you. Don't forget to subscribe and hit the bell icon. Today we're learning about indications for cesarean section. So go ahead, subscribe, and let's get started. Now we will see about the maternal indications for cesarean section. Cesarean section is done when normal vaginal delivery is not safe for the mother. One common reason is cephalopelvic disproportion, where the baby's head is too large or the mother's pelvis is too small, so the baby cannot pass through the birth canal. Another indication is a previous cesarean section, because the uterine scar may rupture during strong labor pains. Cesarean section is also needed in obstructed labor, where labor does not progress despite good contractions. Severe preeclampsia or eclampsia is another important indication, as very high blood pressure and seizures can endanger the mother's life. Mothers with cardiac disease may not tolerate the stress of labor, so cesarean section helps reduce strain on the heart. Lastly, genital tract obstruction such as tumors, fibroids, or scarring can block the birth canal, making vaginal delivery impossible. In all these conditions, cesarean section is the safest option for both mother and baby. Now we will see about the fetal indications for cesarean section, which means conditions related to the baby where normal vaginal delivery may not be safe. One important indication is fetal distress, where the baby shows signs of poor oxygen supply, such as abnormal heart rate patterns. Malpresentations like breech position or transverse lie are also indications because the baby is not in the normal head-down position for delivery. Cesarean section may be required in congenital fetal anomalies where structural abnormalities can make vaginal delivery difficult or dangerous. In multiple pregnancies, especially when the first twin is not in the head-down position, cesarean section is preferred to avoid complications. Macrosomia, where the baby is very large, is another indication because it increases the risk of birth injury and obstructed labor. In all these fetal conditions, cesarean section is performed to ensure the safety and well-being of the baby and the mother. Next is about placental and cord indications for cesarean section, which means conditions related to the placenta or umbilical cord where vaginal delivery is dangerous. One important indication is placenta previa, where the placenta covers the cervical opening and can cause severe bleeding during labor. Abruptio placentae is another condition, where the placenta separates early from the uterine wall, leading to heavy bleeding and reduced oxygen supply to the baby. Cord prolapse occurs when the umbilical cord comes down before the baby and gets compressed, cutting off blood flow to the fetus. Vasa previa is a rare but serious condition where fetal blood vessels lie across the cervical opening and can rupture during labor. In all these conditions, cesarean section is performed urgently to prevent severe complications and to save the life of both the mother and the baby. Next are labor-related indications for cesarean section, which occur due to problems during the process of labor itself. One common indication is failure to progress in labor, where despite good contractions, the cervix does not dilate properly or the baby does not descend. Failed induction of labor is another reason, where medicines are given to start labor, but effective contractions do not develop even after adequate time. Uterine rupture, either impending or actual, is a very serious condition, where the uterine wall starts to give way or tears completely, especially in women with a previous cesarean scar. In these situations, continuing labor can be life-threatening, so cesarean section is done immediately to protect both the mother and the baby. Next are elective indications for cesarean section, where the surgery is planned in advance rather than done as an emergency. One elective indication is maternal request, where the mother chooses cesarean section after proper counseling and informed consent, even when there is no strict medical reason. Another indication is precious pregnancy, where the pregnancy is highly valued, such as after infertility treatment, repeated pregnancy losses, or advanced maternal age. In these cases, cesarean section is often preferred to minimize risks and to ensure the safe delivery of the baby. Thank you for watching. If you found this video helpful, please like, comment, share, and subscribe for more nursing and medical education content.